Hi and welcome to the Grange Clinic Edit. I'm Aenone Harper, Machin, consultant plastic surgeon.
I'm Parneet, Gill, consultant plastic surgeon.
And today we are going to talk everything CO2 laser. So this is something that I personally don't do as part of my specialty interests.
Yep.
But I know that this is very much your specialty interest.
Yes.
Both within the private sector and also for your NHS patients as well. So I want to know an awful lot more about this because I do send you quite a few patients.
Yes, you do.
For this type of thing, and it is because one, I don't do it myself, and two, some of the stuff I send patients to you for is because I think the treatment that you deliver for them is excellent. So what is the CO2 laser and what can you use it for?
So CO2 laser is an excellent alternative to surgery in specific cases. Okay. So if you follow me on Instagram, you'll know that I absolutely love the CO2 laser. It's great. What it allows us to do is there's two different things really. So you've got your CO2 ablative option, which is a bit more like a scalpel where actually you can remove tissue. So that's great for removing benign lesions, moles, which are not malignant, of course, and also in treating things like rhinophyma, which is reshaping the nose after rosacea has sort of made it into a
very thickened,
bulky appearance. So that's the ablative side of things. So CO2 is great for that. The other option, which I think is
kind of ablative, means to basically burn away.
Yes. Yeah. So ablative, back in the day when lasers, especially CO2 lasers, were first starting to be used, the ablative option was the most common option. So that basically means burning away the whole of the epidermis and dermis. So the whole of the skin, and you can go fairly deep with it depending on what you're treating. So if it was back in the day for rejuvenation, it was the epidermis, so the top layer of the skin. If it was for lesions, you go a bit deeper until you've removed the lesion. So it's a bit more hard hitting. I still use it a lot, not for the rejuvenation side, but for removing lesions and for rhinophyma. So it's an excellent modality for the correct treatment option, depending on what it is that you want to treat, basically.
Okay. And so that sounds pretty harsh, but say you're wanting to do a bit of facial rejuvenation. Yeah. How does that work now?
So
because
now
that's quite different, isn't it?
It's very different, yeah. So now we use what we call fractional CO2. So it's still the CO2 laser, but the way we use it is different. So instead of burning everything, what you do is you're making little holes in the surface of the skin.
So like microscopic.
Yeah, so little holes. And what that means is that there's normal skin in between the areas that you're treating that will allow the healing process to happen a bit quicker. So what that means practically is that the downtime is less. And in terms of risks, it minimises the risks of things like hyperpigmentation, scarring, because you've still got the normal skin that's there amongst the area that you're treating. So the small holes that are made allow new collagen to form through. So in terms of rejuvenation, this is where the new collagen sort of kicks in. And it also allows any indentation from, say, fine lines, wrinkles, or I use it a lot for acne scarring treatment as well. It allows those scarring and the indentations to basically soften up a little bit. It allows it to be released, and then the new collagen forms, and then the tightness kicks in. And in terms of the wound healing, it's basically a controlled burn. So the way we sort of use it is we're modifying the settings to allow the skin to have a little bit of damage, but it's controlled damage, which allows it to heal and to, all the rejuvenation side of it then kicks in because of that healing process.
And what is a laser? I mean, because they're all like lasers and that type of thing. And there's so many, like you can go to a lot of high street shops and they're offering laser rejuvenation and that type of thing. What makes the CO2 different? And as a medical practitioner, as a surgeon, why do you choose to use the CO2 laser over other things? Is it more effective? Is it, what is it about it that you would recommend for patients?
So with you may have heard of lasers and IPLs and other sort of treatments that are used on the high street. With the laser, it's, without getting too technical about what it is, it basically targets a specific thing. So for example, the CO2 laser targets water in the skin, and it targets it at a specific wavelength, so it's very consistent. And it goes to the same depth, same sort of target. And what it means is that you're consistently treating the area in a controlled manner, which is very accurate. So this is different to, say, microneedling or microdermabrasion, which, although, treats the epidermis of the skin, so the top layer, you're trying to increase collagen production. With that, it's very user dependent. So in terms of the needling, you can push a bit deeper. Every single hole made with the needle is not exactly the same depth. No matter how hard you try. Microdermabrasion, it depends on how much force you're putting. So it is very user dependent. Whereas with the laser, everything is done at exactly the right sort of, depth, right setting, right energy, and the same wavelength. So it's very, very accurate and can produce very consistent results. And because of the way the laser is, I can tweak the settings to go on a slightly higher power or for a little bit longer. So what that means is I can offer a bit more tightening or change it so that it gets me the best result for that patient, for that, whatever it is, if it's wrinkles or if it's acne scarring.
Yeah.
So it allows me to modify it in a very controlled way to get you longer lasting results, which are a bit more hard hitting really, rather than just a little bit of, rejuvenation.
Or
so it's far more, gives you a longer lasting result. And actually by tweaking the settings, I can hit the skin pretty hard but safely.
Yeah. And that is why, like, when I do a facelift, and what I say to patients is it's wonderful for doing certain things, but it's very difficult and it does not treat the lines around the mouth.
Yes.
Because if you did that with surgery, that would completely distort the mouth. So very often I send my patients for round the mouth kind of resurfacing following surgery and facelifting, just because it improves and kind of almost, I say, puts the cherry on the cake. It finishes off that look.
Yeah, I think they've both got very different places really. So with the facelift surgery, you're tightening the skin, you're restoring the volume to where it should be, you're making a good foundation overall for the rebalancing of the face. But the skin itself, you don't do anything to apart from the laxity. So the quality of the skin in terms of the texture of the skin, in terms of the glow of the skin, in terms of the wrinkles, specifically, as you said, in the middle of the face, so specifically around the mouth, the skin's really stuck down in that area. So it's very what we call adherent. So in order to release that and improve it, you do need to have a bit more sort of active treatment to the surface of the skin, not underneath it. So that's where the CO2 laser comes into its own really. And like I said, it's a cherry on the cake, but it allows me to do a really good treatment around the mouth. But what we tend to find is with facelift patients, if they have a full face resurfacing done as well with the higher setting around the mouth, it gives such a lovely result.
Yeah.
It just gives, that final finish to the scars. And also, what I tend to do with the facelift patients as well is go over their scar as well. So it improves the scar from the facelift, which is usually well hidden anyway.
Yeah.
And then also in terms of the mouth area, I normally do a second session, usually after 3 to 4 months, just targeting specifically the wrinkles and the fine lines around the mouth. And that just finishes it off really well.
Beautifully. And the patients love it.
Absolutely.
Go ahead with it.
Yeah.
They do genuinely love it. And it really does just complete kind of that surgical journey. And we can always if you can improve a scar, happy days.
Oh, for sure. Yeah.
Exactly.
Definitely.
So I've had very light CO2, and it is tunable.
Yes.
And it's tunable to the downtime that you're willing to accept. And tunable to kind of what you're wanting to achieve. What are the sort of results that you can achieve? What could you expect after, a CO2 laser sort of treatment? What are you feeling afterwards and things?
So immediately on the day of the treatment, so there's no needles involved, which is great. We put topical anesthetic cream on for about 45 minutes that numbs the face. I also use a cooling apparatus as well when I'm doing the actual treatments. That makes it a bit more comfortable.
Much more comfortable.
Yeah, so it really does help. As well as other things that, a few little tweaks that I do when I'm actually doing the treatment, just to make it as comfortable as possible for the patients.
That's your chat, surely.
Yeah, yeah. So it does work. But, I've had it done myself as well. So I know the pain points, But actually there aren't any, because with we double up the LMX, the cream, and actually, you know that you're having something done, but it's not tender at all.
Or particularly painful.
Yeah. And then so on the actual day of the treatment, once you've had the cream on for 45 minutes, we do the treatment, we protect your eyes. That's a very important thing.
Safety with lasers.
Yeah, exactly. We wear protective goggles as well. If I'm treating the eyes, because I can actually treat the eye area as well as the face and the mouth. So it's, with treatment of the eyes, then I use an intraocular shield. So it's like an internal contact lens, which is a metallic contact lens. But we put eye drops in, so that doesn't hurt. It sounds a little bit brutal, but actually it's fairly straightforward. I've had it done myself, and I know it's not painful.
Yeah.
So once that's in, I can actually then treat the whole of the eye area, which is great because this eye skin is usually a little bit thinner, a bit more crepey, and that just gives it a bit of a boost. So rejuvenates the eyes as well. And then obviously we treat the full face. Once the treatment is done, then what you'll feel is it'll feel a little bit hot, a little bit tight, and a bit like sunburn. You get that prickly sensation. So straight away we put some self-soothing serum on, which is a nice cooling way of just maintaining that, the post-laser tightness. And then we give you a few things to take home with, like a gel mask that you can put on that just helps with the cooling. So initially it will feel a bit hot, it will feel a bit prickly, it will feel a bit tight. Then after a few days, that tightness will still be there, but the prickliness will settle down. You don't need painkillers, so it's just a case of cooling it down and using the serum rather than any painkillers per se. Then after about the first sort of 2 to 3 days, it's not sort of tender, it's just very, very dry. So we normally give
like sandpaper.
It's just very, very patchy, a bit dry. So you just want to be moisturising your skin at this point. So we normally give some moisturiser as well, non-perfumed, and that will just help soothe everything. So the first week is usually the week I say you want to hide away. You're not going to be wanting to go out putting makeup on, that sort of thing, because it's going to look, like your skin's just coming off in little pieces, it's a bit dry. And so the first week done. By the time you get to the second week, it's more about protecting the skin. So it will be a little bit pink, it may still be a little bit swollen. And then, you're onto your high factor sunblock to prevent any hyperpigmentation. And usually in the second sort of week, you can start to put makeup on if you want to. But actually a lot of my patients will put on tinted SPF, and that's enough. And then after that, the healing process is you're well and truly beyond the initial phase, and it's not, too bad then.
And then it just does continue to improve.
Yeah, so the initial first few weeks is when it's healing from the immediate effect from the laser. So, when the skin's peeling away and all that sort of thing. And then after 3 months, that's when you get like a second boost. You get another bit of tightening, and that's where you get the neocollagen kicking in. So that's the new collagen that's been allowed to make its way up those little tunnels of, the holes that we've made, and you get a second wave of tightness, which is fab. Yeah. So it's always a nice little surprise.
And that's sort of in what we call sort of basic science terms, it's the collagen reorientating itself. So initially as it's healing, it's a wee bit disorganized and kind of tangled up, and then as it heals fully, it comes into sort of a linear type collagen, which then gives you that change at about the 3 month markish to do that. You mentioned pigmentation. Mm-hmm. What are the side effects? What are the complications of laser treatment?
So with any kind of laser treatment, not just CO2, I always do a patch test first. So that's basically treating a small area of the skin to check that you don't get any of these side effects, which can include blistering, burns, scarring, hyperpigmentation, which basically means the skin can go lighter or darker than the surrounding skin. So those are the sort of main things. But again, it sounds really scary, but actually the whole point of the patch test is to make sure that your skin heals okay after on those settings. If it doesn't, then obviously we won't do the treatment, or we can tailor down the patch test to turn the settings down and do a sort of a new patch test. Yeah. But often it's not really an issue. The one sort of caveat to that is in patients of colour. So, for example, for myself, I've had CO2 lasering resurfacing done.
I was going to say, and we are both at different ends
of the melanocytic spectrum.
Yeah, exactly.
So we have to be a bit more careful in patients of colour because of the pigment risk or the hyperpigmentation risk. So in those, myself, in those patients as well, then I would do a bit of what we call priming of the skin first. So what that basically means is preparing the skin to minimise the risk of pigmentation. So that can include things such as hydroquinone cream, which dampens the melanocyte activity, which are the cells that give the pigment. So it calms it down a bit. Yeah. So if if you need to be primed, then what I normally do is start the cream 4 weeks before the laser treatment, and then you continue on for 4 weeks afterwards as well.
Yeah.
This is in addition to using a high factor sunscreen, ideally a tinted sunscreen, because that adds an extra layer of direct blockage from the sun rays, and that reduces the risk of pigmentation as well.
Yeah.
In addition to this, we also now have been using transdynamic acid tablets, which have been shown to work really well in reducing hyperpigmentation. So I also, as an extra bit of protection, give the tablets as well.
Yeah, which are tablets that are generally used for like heavy periods and stuff.
Yeah.
They are clot stabilizers. But actually, as a byproduct of that, they found that it does affect sort of melanin production within the skin. So pigmented areas get lighter if you're on tranexamic acid, basically. So.
And it's a slow burner with the tablets. You have to take them for a good few months to get the effect. And I've tried them as well. They, I feel like they do work, but again, I use quite a few different things, in terms of my skincare regime, retinols at night, SPF. So, they do fit in nicely with my regime. I don't know whether them on their own are enough to reduce pigmentation, but I think as a combination, they definitely do well. Yeah.
Okay. And so then, therefore, who would you recommend would have this type of treatment? Age range, skin type, problems that they're having?
Easy answer is anyone, really. I would say, if you're worried about, not even worried, if you want to treat yourself a little bit and, reduce some of the fine lines, so it's great to reduce sort of fine lines, wrinkles, pigmentation. If you want to have a little bit of tightening, specifically around the eyes, if you're a bit younger as well, it works really well. It just gives you a little bit of a boost. It increases collagen production, gives you a bit of an extra glow to the skin. So yeah, I think if you want a little bit of, any of those, it works really well. For scars as well, if you want to improve scars, that's the next group of patients.
Yeah.
So in terms of scars, it depends on the scar type. So you have scars which are sort of indented, scars which are raised, scars which are very lumpy. So there's different sort of causes of those scars. And the laser can be used either in the ablative way, so burning any lumpy scars to flatten them down, or with the fractional laser, which is what we use for rejuvenation. And that's to release the scar, which may be a little bit puckered, and to just help it sort of
pincushion scars. Scars that are like
acne scars,
webbed a little bit, acne scars and things.
Amazingly, fractional CO2 for acne scarring is really good.
Yeah,
really good results.
A lot of those sorts of patients and things, and should see an awful lot more, because there are things, the CO2 laser treats an awful lot of skin problems that probably people have just been managing with, or being told, well, nothing really can be done. So don't worry about it. I think it's a great treatment. There's an awful lot of science for an awfully long time for it, both in sort of rejuvenation and scarring. And we're very delighted to be able to have a consultant plastic surgeon that's able to offer the expertise in something that is fully customizable to that patient.
I think that's the thing, really. You need to, a lot of not even patients, a lot of clinicians are quite sort of worried about using lasers because it is so niche. And, so if you are going to get laser treatment, and make sure it's by someone who knows what they're doing, who's fully trained. And also, there's these at-home lasers that people talk about. You can't really get at-home lasers because if you have a proper laser, you have to have all the safety things in place. At home, it's usually the sort of, the IPL, so the light treatments, which are different to lasers. So IPL stands for intense pulse light. It's basically where there's no single wavelength that's targeted. It's targeting all of the light spectrum from specific settings. So it can treat laser hair removal. It's used for skin things as well, but it's very non-specific. So those are the ones that you often get for the at-home treatments. So you won't get as good results with those because they are non-specific, and the settings will obviously not be as high as, for example, the lasers that we have here, where we can actually treat at a very high level to get a very good result. Perfect.
Is there anything else that I need to ask you about lasers?
I don't think so. I guess everyone always asks, is it painful? And it's not painful.
No.
It feels a bit warm.
It's warm. It's hot.
But the topical anaesthetic cream definitely helps. The cooling definitely helps. I guess when I had it done, the most uncomfortable bit that I found was around my eyes, but even then it was tolerable. So, actually being, completely honest about it, yeah, the eyes were a bit more sensitive and the rest of the face wasn't as sensitive, but it wasn't painful.
Yeah. And to be, to not, because a lot of my patients are a little bit frightened of that. I say laser to them and they're scared. And the fact is that I know that you will be able to treat them in a very safe and controlled sort of manner.
Yeah.
And so for me is quite important, and it's quite important for them. So people shouldn't be frightened of using the laser.